Episode 38L3 of 3 Ishan and an Indian Bio-Composter to stamp out farm fires in India. The senior consultant, pulmonary and critical care, at Indraprastha Apollo Hospital said any health issues impacted by air pollution can't be seen or observed in a short span. Air pollution has a long-term impact on the health of the people. It is like a slow poison and creeps up just as slowly. If the impact of air pollution was immediate, we would have been able to tackle it in the initial stage. It is an invisible enemy. It keeps harming the body without one being aware. One would not know how poor air is affecting a person's quality of life until it starts hampering his daily chores and efficiency decreases, the doctor explained. The director, internal medicine, at Fortis Hospital in Shalimar Bagh in the capital said, if we specifically talk about air pollution, people have developed respiratory issues, lung-related diseases. This means that patients have more of shortness of breath. Their asthmatic and COPD situation appears to be worsening as air pollution goes up. He painted a grim picture. Patients with chronic sinusitis are coming back since their attacks are more frequent. Air pollution is also linked to cardiovascular diseases and lung cancer. There can be some developmental issues in newborn babies as well, the doctor said. In India, 35% of COPD is due to cigarette and tobacco smoking, while 65% of COPD patients are non-smokers, said the principal director and head at Max Super Specialty Hospital, Saket, New Delhi. In non-smokers, COPD is usually seen in women who have been exposed to smoke coming from a chulha in the early part of their lives. In addition, exposure to air pollution, both indoors and outdoors, also leads to COPD. Recurrent childhood infections could also cause this disease at an older age as uncontrolled asthma, the doctor added. How are kids impacted by the worsening air quality? A consultant pediatrician at Jain Multi-Specialty Hospital said that poor air quality is a major cause of health problems in children. Air pollution is affecting the fetus and continues to do so all its life. We have seen increased lower respiratory tract infection, allergies, asthma, bronchitis. Hospitalization has also been on the rise for children. Researchers looked at fine particulate matter data from the EPA, PM2.5, or the fine particles that can penetrate the lungs and pass into the bloodstream, finding the children's blood contained markers of systemic inflammation. Additionally, PM2.5, which refers to particulate matter measuring 2.5 micrometers or smaller by the EPA, was linked to lower cardiac autonomic regulation assessed using an electrocardiogram. Specifically, researchers used data files maintained by the EPA, which have daily air quality summary information from each outdoor monitor in the country. Air pollution is also responsible for poor cognitive functioning of the brain. There is a rise in ADHD, and overall growth and development is also getting affected, the doctor said. He added that there is an increased risk of diabetes, cardiovascular diseases, and skin allergies. We definitely need to be worried that our children are at risk, all because we can't give them cleaner air to breathe, the doctor said. Mary noted that the focus of residents against wood smoke emission particulates, ROSEP, is on the health effects to near neighbors of living next to residential wood burning, in those hyper-localized areas where the source of particulate pollution, PM2.5, is concentrated. PM2.5, particulate matter of 2.5 micrometer size, is the perfect size to infiltrate the human lung, causing a cascade of human health problems. Wood smoke consists of 90% PM2.5. Residential PM2.5 monitors can be purchased by neighbors from Purple Air for less than $300, and their locations are put on the online Purple Air map, along with data uploaded every 10 minutes, available to the general public, and of course, to governmental authorities. Neighbors of residential wood burners would like their Purple Air PM2.5 monitor data to be used to regulate and shut down residential wood burning detected at neighbors' fence lines that exceeds the World Health Organization, WHO, standards of 5 micrograms per meter cubed or future U.S. standards of 8 micrograms per meter cubed. There could even be court-ordered monitoring using a neighbor-owned Purple Air PM2.5 monitor as a breathalyzer, similar to car breathalyzers court-ordered for repeat drunk drivers, to turn off the ignition of a neighboring indoor wood stove when levels of PM2.5 in a near neighbor's yard is exceeded. In this way, governmental authorities would not have to check the make and model of an appliance and would not have to rely on unreliable certification and other worthless assurances of levels of wood stove particulate emissions by the company that manufactured it. Purple Air monitors also provide data every 10 minutes 24 hours a day, and data can be downloaded from the map by governmental authorities the day after the PM 2.5 levels are exceeded, during normal government working hours. Purple Air PM 2.5 monitors are so reliable and accurate they are put on U.S. Air Now smoke and fire maps alongside $100,000 Environmental Protection Agency, EPA, monitors, correlated to the EPA monitors with a simple mathematical formula. But to publicize this, it is necessary to point out that living hyperlocalized next to a residential wood burner is essentially the same as living hyperlocalized next to any kind of PM 2.5 emitting wood burning appliance, next to a PM 2.5 emitting wood burning wildfire, or next to a PM 2.5 emitting industrial biomass wood burning facility.